Welcome back to Ironman. Jason Wygant, James Stewart, and the good Dr. Joe McGinley from the McGinley Clinic joining us to give you some insight into the unfortunately common injuries that you see in motocross. We do see trends, all of a sudden Achilles and thumbs, all of a sudden ACLs. But I feel like one thing is consistent with motocross, the shoulder injury. And I think people misdiagnose which is which. So give us some clarification on these words that we hear.
Yeah, we talked about it. There's been a few categories of injuries this year. Shoulders have come up frequently.
Yeah.
The two main that we talk about are separations and dislocations.
Yes.
When you think separation, think AC joint, that's your clavicle, collarbone. There's several ligaments that hold those structures together. When they get injured, they can pull apart and separate on that joint.
Okay.
When you talk dislocation, that's the main joint of your shoulder, your glenohumeral joint. A couple structures that can be injured there, the labrum, which is sort of like the gasket of the joint.
All right.
And then several ligaments that hold that tight. So two separate types of injuries. The mechanism can be similar. It's typically a fall with an outstretched arm. It puts abnormal forces on the shoulder and can disrupt the ligaments either at the AC joint or glenohumeral joint, depending on how they hit. Typically, the solution to this is try to tuck and roll. I know that's easy for us to say up here in the booth when we're not out on the track. But if you're going to fall, you can actually practice this. You can practice rolling on the ground at home in a soft area and tucking that shoulder and rolling. You can develop muscle memory to help with that when you're falling. So that'll prevent some of these injuries when possible.
I used to tell people crashing was a skill, like the tuck and roll. I was able to roll out a lot of them. But no, that's interesting because I didn't know the difference between it. I've been talking, I separated my shoulder, but I actually dislocated my shoulder, and it was out for 2 days. So on that part, if you have a dislocation, is the best thing to recover is to be able to hopefully get it back in as quickly as possible? Is that kind of what if you can, obviously?
Yeah, that's correct. I mean, the muscles are going to tighten up. Sometimes it can be hard to do that. You'll want to get it assessed to make sure that nothing's damaged. There's blood vessels, nerves around there. There can be fractures with dislocations. So really, it just depends on the mechanism of injury and how bad it is. But yeah, you'll want a medical evaluation as soon as possible just to make sure that everything's okay. And that if you do reduce it, that you didn't do any damage to the blood vessels or nerves in that reduction.
Now, what we've seen, we're watching Casey Cochran, unfortunately, had the dislocation at Southwick. It almost feels like 50-50. Riders get surgery sometimes for both separation and dislocation, and sometimes they don't. Where's the line there? Which direction to go?
Yeah, that's going to be based on the imaging. So if there's ligament injury, significant labral injury with a dislocation, that joint's going to be unstable. And you don't want it to keep popping out because that's when you'll start getting damage to the cartilage and joint structure itself. Oftentimes at our clinic, we'll supplement with cell therapy. We treat a lot of labral injuries with stem cells, PRP, with excellent results. So football players, all type of sports. So again, you want to look at the degree of the injury and see. The AC joint separation, that typically is less likely to require surgery, so the dislocation more common than the AC joint separation.
So you can get, with some of the recovery, reasonably close without the surgery on the labrum with the dislocation.
That's correct. Again, we're more aggressive on the conservative treatments at our clinic, so a lot of times when you have a separation or dislocation, we're going to try cell therapy first. Unless it's clearly an unstable shoulder, then surgery is going to be required. So surgery should be the last resort and the final option in these situations. And there's a lot of new technologies and treatments out there that can get these fixed and keep you out of the operating room and keep that scar off your shoulder.
Yeah, because, the scar doesn't look great. Although, some people dig it, I guess, they say. But in general, once you have surgery, is it ever quite the same?
Well, again, surgery is an invasive procedure. No matter what, you're going to have scar tissue, and it always feels a little bit uncomfortable, no matter how big the scar, how minimally invasive. Even if it's a scope procedure, you can get scar tissue. So it's never actually normal again. Anytime you injure tissue, no matter how we treat it, it's never normal again, cell therapy or surgery. So you want to take the least invasive approach possible. If you can get away with just physical therapy and strengthening and not have anyone poke you with the needles or a scalpel, then that's the best option, that's for sure.
We love the doctor who's actually saying, I'm not just trying to put you on the operating table. All right. Thanks, Dr. Joe. Unfortunately, shoulder injuries, always a topic.